So Brain Teaser, in association with Ophthalmological Society of Nagpur, again presents a pan-India intercollegiate quiz that is Big Q. Yeah. So this is the signature tune of Brain Teaser in its fourth season. So Brain Teasers have completed its fourth season. In fact, this is the fourth season, should I say that, if that correctly? And it is for the second time we are doing an India postgraduate quiz on the Brain Teaser platform, and this is so. So that okay. This season we also have quiz masters from across the country who are not only proficient and ace quiz masters of the region. Today we have the privilege of having three quiz masters, Dr. Aurav Luthra and Ace. The second quiz master is Prashant Radhakrishnan from Amrita Institute of Medical Sciences, Kochi. Again a retina surgeon, and the third is Dr. Madhu, an ace cornea surgeon from Vizag, Pradesh. Friends, don't go upon his. He's an ace quiz master of his twisted. Have your prizes for principles of. Remember, postgraduates, not only about quizzing and winning the prizes. Besides winning, besides, we'll give you every party. Prize of rupees make it into the final. We are thankful to Mr. Sai Krishnan and his numerotech for giving efficient back office for smooth conduct of this online event. Yes, our trade partner Micro Labs have been very generous, and all the prizes and all the financial part is taken by Micro Labs. We are indeed thankful to Mr. Ashokan, Executive Vice President, and Mr. Navneet, who are really working hard for us to reach out every student in any corner of our country. Here is a promo from Micro Lab. Shilpi to share you with the format and familiarize you with the format and also the rules of the game. Shilpi, over to you.
Thank you, sir. Welcome back to the 6th episode of Big Q. So quickly we'll go through the rules. So season 2 every Wednesday at 8 p.m. So platform is Kahoot. Total 15 episodes, and today is the 6th episode of the preliminary round. So we will be having 2 more preliminary rounds, 4 quarterfinals, 2 semifinals, and 1 final. So out of the 8 preliminary rounds, you need to play minimum 4 so that the best of the 4 performances will be counted so that you can qualify for the quarterfinal round. So in quarterfinals, we will be having 80 teams, 20 teams per quarterfinal. And out of these, 20 teams will qualify for the semifinals and 10 for the finals. So Kahoot platform will be used to answer the questions, but you need to log in to the Zoom platform also. The first screen is a Zoom platform. So here your video should be on, but audio off. And the second screen, Kahoot, I already informed that it is to answer the questions. Mentors need to log in from a separate screen only on the Zoom platform. So now coming to rules once again, the format is 9 rounds, 6 sets of MCQs. Each set contains 5 questions, 3 sets of one-liners with 5 questions in each set. The assessment will be done on the basis of fastest finger first. There will be no negative marking. Finally, the judge's decision is binding for everyone. So now look at the prizes which the teams will win in the finals. The 6th team will carry away 5,000 rupees. 5th team will get the 10,000. The team at the 4th position will get 15,000. 20,000 will be taken by the 3rd team. And in the ascending order, it is 30,000 by the 2nd. And the winner will get the 50,000 rupees. So all mentors will get a surprise welcome gift, and the mentors of the 6 winning teams will get the 15,000 cash prize each. So for the audience also who are not postgraduates, per episode, for the second runner-up, there is rupees 2,000. For the first runner-up, it is 3,000 rupees. And for the winner, it is 5,000 rupees. So our today's quiz masters are Dr. Saurabh Luthra sir, Dr. Natasha Radhakrishnan, and Dr. Madhu Udaraju. So now I introduce Dr. Saurabh Luthra sir, who is Director and Chief of VR and Uveitis Services at Drishti Eye Institute, Dehradun. He has organized many national meetings. To name few, that is VRSI 2007, Drishticon Reticon in 2018. He was the organizing secretary of Sight Savers International and RP Center aims in phase 1 and phase 2 awareness. He has a lot of awards to his credit. To name the most prestigious is the Bernadette Foundation for Children's Eye Care Travel Grant for World ROP Congress 2009. He has to his credits 26 publications and 5 book chapters. With this, I hand over the screen to Dr. Saurabh Luthra for the further proceedings. Over to you, sir.
Thank you, Dr. Shilpi, and I congratulate Dr. Prashant, Dr. Shilpi, and the Microvision team for putting this together. And as you know, this is the 4th season and the 6th episode. And I will be sharing my screen now for the first round of MCQs. So are my slides visible?
Not yet.
Are my slides visible now?
No, sir.
No, not yet.
It's not showing up on the share.
You can unshare and redo it.
Yeah, so I've
Just now
yeah, I've unshared. I'm just opening the PowerPoint again.
Yeah, please.
Yeah, I'm just opening the PowerPoint again because it's not showing up on the share. Okay. For some reason, it's not showing up on the share page.
Sai, can you
Is
guide?
it already open in a different window, sir? Please check.
Okay, 1 second. So I'll
You can
just
close that and again open
yeah,
it, sir.
1 second. Yeah, I've reopened. I've quit the PowerPoint. I'm reopening the PowerPoint. Maybe that should work because
Yeah, please.
yeah.
Yes, sir. Now it is visible.
Yeah, it is seen. Can we have full screen?
Yes. Okay.
Okay,
So,
great.
yeah, so welcome to the first round of MCQs. And my first MCQ is, which of the following is not part of the classic triad seen in retinitis pigmentosa? Waxy pallor of the disc, bone spicule pigmentation, pallid disc edema, and vascular attenuation. And your time starts now. So the time is up. And for the first MCQ, the answer is pallid disc edema. So as we all know, pallid disc edema is seen in AION. And we all know that retinitis pigmentosa is a clinically and genetically heterogeneous group of inherited retinal dystrophies with dysfunction of the rods and then the cones and RPE. So over to the second MCQ. What is the earliest sign of sympathetic ophthalmia? AC cells, retrolental flare, Dalen-Fuchs nodule, mutton fat KPs, and your time starts now. Your time is up. So the earliest sign of sympathetic ophthalmia is retrolental flare. So we all know that it's a rare bilateral granulomatous uveitis caused by either trauma or surgery with a subsequent bilateral autoimmune response in the sympathizing eye. And the eye which induces this is known as the exciting eye. We go on to the third MCQ. Artificial intelligence in ophthalmology is being currently developed for all except the choices are diabetic retinopathy, AMD, glaucoma, uveitis. And your time starts now. Time is up. And the artificial intelligence in ophthalmology is being currently developed for all except uveitis. So we all know that for diabetic retinopathy, AMD, and glaucoma, deep learning based technology is being used for quantitative measurements of OCTA, OCTA, and also fundus imaging to utilize artificial intelligence. The fourth MCQ is materials used for stuffing the pit in optic pit maculopathy include all except autologous sclera, Tenon's capsule, amniotic membrane, ILM. And your time starts now. Time's up. And the answer for this question is tenons. So we all know that ILM, inverted flap, amniotic membrane, and even autologous scleral graft is being used for optic pit maculopathy, but not tenons. The last question in this first round of MCQs is, OCT technology with fastest A scan speed is swept source OCT, time domain OCT, spectral domain OCT, Fourier domain OCT. And your time starts now. Time is up. And the answer for this question is swept source OCT. So as all of you know that it has 100,000 A scans per second, as opposed to about 50,000 A scans per second for normal SD OCT machines. So with this, we come to the end of the first round of MCQs. And it's my pleasure now to introduce Dr. Natasha Radhakrishnan, the other quiz master with me, who's a professor and senior retina consultant at Amrita Institute of Medical Sciences and Research Center. And she has a special interest in ROP and uveitis. So welcome, Dr. Natasha. I'll stop sharing my screen now.
Thank you, Dr. Saurabh. Thank you, Dr. Prashant, for this opportunity. I will share my screen now. Is my screen visible?
Yes. Great.
So we'll go on to the next set of MCQs. And here comes your first question. Which of the surgical approaches cannot be adopted for the management of Fuchs endothelial dystrophy? DSEK, DMEK, Descemet stripping only, and Meles technique. Your time starts now. And the answer is, sorry.
Wait, ma'am. I think you used.
Okay. Okay.
Yeah, now you
The
can
end of
share
your
that.
time. And the answer is the Meles technique, which is a technique of DALC, while all the others are the ones that can replace the endothelium. We'll go on to the next question. All of the following are true with respect to conclusions of the mycotic ulcer treatment trial 1, except BCBA was better in the natamycin compared to voriconazole. Incidence of therapeutic PK was higher in voriconazole group. 3-month infiltrate or scar size was greater in the voriconazole group. Natamycin was more effective in clearing culture positivity. And your time starts now. Time's up. And the answer coming up. The 3-month infiltrate or scar size was not greater in the voriconazole group. So that was your answer. We'll go on to the next question. Which procedure will not help in a case of long-standing left abducens palsy with normal ophthalmic neurological functions and neuroimaging? The Nishida procedure, Jensen's procedure, Hummel-Schiem procedure, and the NAP procedure. Your time starts now. The answer coming up now. It is the NAP procedure, which is used for SO palsies. All the others can be used for the rectus palsy. The next question. Cause for Horner syndrome in a patient with ptosis, dim light anisocoria, and no anhydrosis, with 1% phenylephrine, anisocoria diminished significantly. Which of these causes is possible? Brain stroke, Pancoast tumor, radical neck dissection, or cavernous sinus mass. Your time starts now. And the answer is cavernous sinus mass, because it is post-ganglionic after the sweat glands have been supplied. We'll go on to the next question, which is the last in the series. Perimetry shows congruous homonymous hemianopia. On OK and drum testing, there is asymmetric response in left case. Identify the site of the lesion. Optic tract, parietal lobe, temporal lobe, or occipital lobe. And your time starts now. Your time is up now, and the answer is parietal lobe. Cogan sign with the asymmetric response on OKN testing is seen in parietal lobe lesions. So with that, we come to the end of this set of questions, and it's now my pleasure to introduce the next quiz master, Dr. Madhu Udaraju, who is the chairman and managing director of Dr. Ramana Raju's Vision Tree, Visakhapatnam. And as you can see, is an office bearer of a lot of societies as well as institutions. He is a renowned corneal surgeon, very prolific, and is a good teacher as well. He has won several awards, including the AAO International Education Award and the AIOS International Heroes Award. He has also won several Best Paper Awards and has also the rare record of winning all the 7 named gold medals in the APOA Society, which is an amazing achievement. He also has several publications to his credit. So with this introduction, I would like to hand the screen over to Dr. Madhu Udaraju, who will take you over to the next set of questions.
Thank you, ma'am.
Let me just stop screen sharing.
I have done it, madam.
Thank you.
So thank you, ma'am, for the kind introduction. And I thank all the team behind Big Q, especially Prashant sir, for this wonderful opportunity. So without much delay, let us go to the first question. Identify the causative pathogen of this corneal condition that you see in the picture. HSV epithelial keratitis, microsporidial keratitis, adenoviral SP case, or nocardia keratitis. And your time starts now. Time is up. And the correct answer is microsporidial keratitis. So if you see, these are coarse, stuck-on appearance, typical of microsporidia, whereas in adenoviral, you have more pinpointed and precise SPKs when compared to this core SPKs. So next, let's go to the next question. Which of the following is not associated with any abnormality of limbal stem cell proliferation? A, shield ulcer, B, Steven-Johnson syndrome, C, aniridia, D, chemical injury. And your time starts now. Time is up. And the correct answer is shield ulcer. Shield ulcer is associated with VKC, whereas all the other conditions are associated with limbal stem cell proliferation deficiency. So let's go to the next question. What feature on a 37-year-old man optic nerve examination is most indicative of glaucoma? A deep cup, B, a large disc, large cup disc ratio, a nerve fiber layer defect. And your time starts now. Time is up. And the right answer is a large nerve fiber layer defect, which you can see superiorly over here. Let's go to the next question. Most common cause for a corneal transplant in India is 1. Corneal trauma, B. Congenital glaucoma, C. Infectious keratitis, D. Keratoconus. And your time starts now. Your time is up. And the right answer is infectious keratitis. As all of us know, more than 50% of the transplants that happen in India are therapeutic in nature to remove the infection. This followed by regrafts and pseudophakic bullous keratopathy. Now coming to the final answer. Try to identify this organism in gram stain. The options are pythium, fungal filaments, nocardia, candida. And your time starts now. Time is up. And the correct answer is nocardia. These are filamentary bacilli. They should not be confused to fungal filaments, which are more broader and they have septae. Pythium are much more broader without septation. So that finishes the MCQs. Now we have I'll stop sharing the screen. Go to the next round.
It's going to be the one-liner, and Dr. Saurabh will be taking over the first
Yes.
round.
Yes. Yes. Can you see my screen now?
Not yet.
Not yet.
Twenty seconds. Just an instruction for all the quiz masters is that during one-liners, we are giving them 30 seconds, but wait for a while. Okay, we can have a sponsored video, please. First. Yeah. We are thankful for
We thank Microvision for sponsoring this quiz. So we go on to the one-liners. And my first question for the one-liners is, the first FDA-approved gene therapy for vision loss due to biallelic RPE65 mutation-associated retinal dystrophy is called, and your time starts now. Your
Doctor,
time,
hold on, doctor. Do not reveal the answer until I tell you.
Mr. Sai will tell us, and then we will go on to the answer.
Yeah, because they're typing, sometimes it needs time as well as there is a transmission time involved. So we'll have to give them extra time once Mr. Sai confirms us, then only reveal. Can we, Sai?
Please go ahead, doctor.
Okay, so the answer for the first one-liner is Luxturna. So Luxturna uses a naturally occurring adeno-associated virus modified using recombinant DNA techniques to deliver the normal human RP65 gene via subretinal injection to retinal cells. We go on to the second one-liner. The newest anti-VEGF approved for wet AMD and DME is, and your time starts now. We'll wait for Mr. Sai to tell us.
Yes, doctor. Please go ahead.
Okay, so the newest anti-VEGF approved is faricimab. So we know that faricimab by the brand name Vabysmo is the first bispecific monoclonal antibody to target both VEGF-A and angiopoietin or Ang2, and was approved in Jan 22 in the US and September 22 in the European Union. Now the third one-liner. In the ONTT trial, when compared with patients treated with oral steroids, patients treated with pulse steroid IVMP had fewer, and your time starts now. So we'll wait for Mr. Sai.
Yes, we can go ahead.
Okay, so the answer is recurrences. So ONTT was the first multi-center collaborative clinical trial in neuro-ophthalmology, which was funded by the National Eye Institute. And it showed that the IVMP with prednisolone, as compared to prednisolone alone, the patient showed faster recovery, lesser recurrences, and a temporary reduced risk of second demyelinating event of multiple sclerosis. We go on to the fourth one-liner. A child with leukocoria, intraocular mass, and calcification is likely to have, your time now.
Yes, doctor.
Okay, so the answer is retinoblastoma, which is the most common intraocular malignancy in children. And in this, we see a hyperechoic intraocular mass with a hyperreflective foci, which are suggestive of calcification, and they are diagnostic of retinoblastoma. So the next and last one-liner in this round is sub-RP ring-like lesion, RP elevation, and sharp peak PEDs on OCT are characteristic of, and you have to enter an abbreviation here. For example, if it was central retinal vein occlusion, you would enter CRVO. So that's just an example. So your time starts now. Time is up. We'll wait for Sai.
You can go ahead, doctor.
Okay, so the answer is, as you might have guessed, it's PCV. So polypoidal choroidal vasculopathy consensus nomenclature and non-ICG diagnostic criteria were given by the Asia Pacific Ocular Imaging Society PCV work group. And these were the three signs: sub-RP ring-like lesion, NFAS, OCT complex RP elevation, and sharp peak PD. Over to the next round of one-liners by Dr. Natasha. I'll stop sharing my screen.
Yeah, we can see the screen, Natasha.
No, I need to change it to get the timer. So that is audio settings. Okay, no, that's not what I'm looking. Can someone help me? If you want to hear the
Sai?
timer.
On the top of the screen, you have view options. In that, you can go and do that. At the top of the screen, move at the top, and the right side, you might see view options. Press view option. There you can have
No.
on the right side of the screen, I mean.
Share sound.
Yeah, correct.
Right. Okay. So our first question is you have to unscramble the words that are given to you. The Mizuo-Nakamura phenomenon is seen in which condition? So the word letters have been given to you. You can unscramble it and make your word. Your timer starts now. No, it's not coming.
Press next. Enter.
I am pressing next. It's not coming.
Hold on, madam.
Yes. Okay. Okay, your time is up.
You can go ahead with the answer.
Okay. So the answer is Oguchi's. The Oguchi's disease is a part of congenital stationary night blindness with manifestation, where you will get bleaching of the retina when you put light on it. And that bleaching phenomenon is called the Mizuo-Nakamura phenomenon. We will go on to the next one-liner. Brush field spots on the iris are seen in which syndrome? So you can understand that it should be just one word in your answer. And your timer starts now. We'll wait for the sign to give the answer.
You can go ahead, madam.
So the answer is Downs is what we want, not Down syndrome, but Downs. So these are light spots seen on the iris, which are fairly harmless, but it is just a marker of Down syndrome. We'll go on to the next one-liner. Seesaw nystagmus is seen in which tumors? And your time starts now.
You can go ahead, madam.
Seesaw nystagmus is seen in, the answer is chiasmal tumors, pituitary tumors, you can get it, and you can get it in the Rathke's pouch tumors. And it's also called the seesaw nystagmus of Maddox, where one eye elevates and intorts and the other eye depresses and extorts. We will go on to the next one-liner. Which is the only anti-VEGF agent that has been approved to be delivered through a port delivery system. Recently approved to be delivered through a port delivery system, and your time starts now.
You can go ahead, madam.
I don't know how many of you got that right. It is not anything new. It is a very familiar anti-VEGF agent, ranibizumab. So it has been approved for a flange delivery system, and it stays there in that port of entry for about 6 months, and it's called Suvismo. We'll go on to the last question of the series. Sunny side up lesion at the macula is seen in which condition? Your timer starts now.
You can go ahead.
And bringing up the answer, sunny side up is Best vitelliform dystrophy. So Best vitelliform dystrophy, as you all know, has a classic egg yolk appearance, which is why it also has that name. It passes through 5 classical stages, and it is in the vitelli-eruptive stage that the visual acuity is usually affected, not in the egg yolk stage or the vitelliform stage. So that brings up the last of the one-liners from me, and I will stop sharing my screen and we will go on to Dr. Mathu.
Thank you, ma'am.
Can you help, Sai? Thank you.
Yeah. The screen is visible, right?
Yes.
Okay, so let's go to the first one-liner question. So look at this picture carefully. This is a DM scroll that has to be injected into the eye. And you see the orientation of this scroll. The comment here is the DM scroll here is upside down. I need to change its orientation before I go inside. Is it true or false? And your time starts now. Time is up.
Wait for a while.
You
Yes.
can go ahead, doctor. You can go ahead.
Right. So the answer is the DM scroll was oriented in a correct way. So you have to always remember that the DM scroll, the orientation is the winner sign. So it rolls over itself. So the orientation that you saw in the picture is correct. So it is not upside down. So now let's go to the next question. So identify this classical pathology. That is the Swiss cheese pattern. And you can see this double-walled endospores, sporangia, chronic inflammatory reaction. It is very classical of a clinical condition. And your time starts now. Time is up.
You can go ahead, doctor.
Yeah. And the answer is rhinosporidiosis. The spores and the sporangia that you see there in the picture are typical of rhinosporidiosis. Next, go to the next question. Identify this logo of an international association. As already explained, try to put in the abbreviation. For example, All Indian Ophthalmic Society is AOS. Similarly, just put in the words and your time starts now. Time is up.
You can go ahead, doctor.
Yeah. And the correct answer is American Academy of Ophthalmology. Till a few years back, it was the world's largest society. And proudly, our AIOS has now taken over as the largest society in the world. Going to the next question. Identify the syndrome shown in the specular microscopy picture. It is a classical reversal appearance. So try to identify the syndrome in abbreviation, and your time starts now. Time is up.
You can go ahead, Doctor.
The correct answer is ice syndrome, where you see the reversal appearance of specular microscopy. In regular specular microscopy, you have dark cells and light intercellular spaces. Here it becomes reverse. Let us go to the final one-liner question. Unscramble the words and identify the syndrome. So if you see here, you can see marked keratoglobus. There is also a DM detachment that is there because of this keratoglobus. Then you have this marphanoid features and hyperextensible joints where you see the reverse namaste sign. And then you have a mitral regurgitation on the 2D echo when you do the 2D echocardio. And your time starts now. Time is up.
You can go ahead, Doctor.
The correct answer is Ehlers-Danlos syndrome. Thank you. Now I request Saurav sir to start the final round.
Thank you, Dr. Madhu. And I will share my screen now. Can you see my slides?
Not yet.
Not yet. I've unshared and still it's not coming up. 1 second. I'll just do it again. Sorry about this technical snag. So I've opened the PowerPoint. I'm going to share it now. Let's hope that it works this time. For some reason, it's not showing up the PowerPoint. Is there any other way to project these slides from Mr. Sai's end, or?
Okay, shall I do it for you?
Yes, please. I think I got it. Yeah. So I think I have it now, finally. Please let me know if you see the slides.
Yeah, we can see. Great.
Okay. Yeah. I hope the sound works. Let me see.
It's fine. Go ahead.
Okay, so my second round MCQs, the first MCQ is, which of the following gives true color fundus imaging? Heidelberg Spectralis, Claris, Optos, Mirante. And your time starts now. The time's up. And the answer for this question is Claris. So Claris from Zeiss is a digital ultra-wide field imaging system powered by broadline fundus imaging, which uses both confocal SLO and traditional fundus photography to give true color imaging. My second MCQ is, which of the following HLA associations is a mismatch? HLA-B27 ankylosing spondylitis, HLA-A29 rheumatoid arthritis, HLA-B51 Behçet's disease, HLA-B8 SLE. And your time starts now.
I didn't catch that. Could you try again?
Sai.
Yeah, you can go ahead, doctor. It's timed out. Don't worry.
Yeah, I think there was some problem with the Siri popping up in between. I'm sorry about that, but so the answer for this is HLA-A29 rheumatoid arthritis. Actually, HLA-A29 is for birdshot chorioretinopathy, and we all know that it causes oval yellow creamy lesions around the posterior pole and radiating from the optic nerve. And rheumatoid arthritis is incorrect. I go on to the third MCQ in the second round, which is, when compared with serpiginous choroiditis, what is not true for serpiginous-like choroiditis? Mostly unilateral, significant vitritis, lesions in the posterior pole and periphery, juxtapapillary lesions contiguous with the macula. And your time starts now. Time's up. The answer for this question is juxtapapillary lesions contiguous with the macula. We all know that serpiginous-like choroiditis or serpiginoid choroiditis is basically serpiginous choroiditis with an infectious etiology. And in this, the juxtapapillary region, the region is typically spared. Next MCQ. What is not true for idiopathic juxtafoveal telangiectasia or MACTEL type 2? Neurodegenerative disorder, retinal cystic degeneration, intraretinal crystalline deposits, anti-VEGF treatment of choice for all cases. Your time starts now. Time's up. The answer for this question, anti-VEGF treatment of choice for all cases. It's only when a CNVM is seen in cases of MACTEL type 2 that we use anti-VEGFs. Otherwise, we do not use anti-VEGFs for MACTEL type 2. The fifth question, which is my last question in this round. Which of these peripheral retinal degeneration lesions needs prophylactic laser barrage? White without pressure, retinal tufts, lattice degeneration with holes, white with pressure. And your time starts now. Your time's up. And the answer for this is lattice degeneration with holes, because we know that white without pressure has a very low risk for RD. White with pressure is benign, and retinal tufts also don't need prophylactic laser, but lattice degeneration with holes, when associated with vitreous traction and when symptomatic, need treatment. So I come to the end of my MCQs. I'll stop sharing my screen and Dr. Natasha will come to her second round of MCQs.
Is my screen visible?
Yes,
Yes.
yes, Dr. Natasha.
So we'll go on to the next set of MCQs from me. Name the disorder in a patient of stroke who sees the moving objects in his blind hemifield, but he cannot see static objects. Static objects are invisible. And your time starts now. And sorry, Anton syndrome, palinopsia, redox phenomenon, visual anesthesia. Your time starts now. Let's see the answer now. And the answer is redox phenomenon, which is when they can see moving objects, but static objects are invisible. But Anton syndrome is seen in occipital lobe lesions where they deny blindness. Palinopsia is just okay. It's not related to the redox phenomenon at all. Neither is visual anesthesia. We'll go on to the next question. I've suddenly just completely gone blind on palinopsia. Can someone help? Okay, let's go on to the next question. Standard 25 gauge vitrectomy surgery requires sclerotomies of size 0.9 mm, 0.64 mm, 0.5 mm, or 0.71 mm. Your time starts now. We'll go on to the answer. The answer is 0.5 mm. 0.9 mm is your standard 20 gauge vitrectomy, and the 25 gauge is only 0.51 mm. The next question. The dose of anti-VEGF ranibizumab that has been to be administered in a child with ROP zone 2 stage 3 FDA approved dose is 0.5 milligram, 0.1 milligram, 1 milligram, or 0.2 milligram. Your time starts now. And the answer is 0.2 milligram. Half the adult dose has been approved. We'll go on to the next question. Silent choroid inflorescence angiography is a phenomenon that is seen in Stargardt's macular dystrophy, Sosby's macular dystrophy, Best disease, or weak age. Your time starts now. And the answer is Stargardt's macular dystrophy. Although we think that Stargardt's is a macular dystrophy, it is named a macular dystrophy, it's actually a pan-retinal dystrophy in which there is lipofuscin deposition across the choroid, Bruch's membrane across the retina. That is why you get a silent choroid or a dark choroid where you cannot see the choroidal flush. The other conditions are not, you don't get this phenomenon. We go on to the last question in this set. Which of the following is true regarding the newly added ICROP3 term notch? The notch refers to a vascular change on the optic nerve. Presence of a notch does not affect the staging of ROP. Presence of a notch may lead to a more anterior staging of ROP. Presence of a notch may lead to a more posterior staging of ROP. And your time starts now. Time's up. And the answer is, it leads to a more posterior staging of ROP. Although we have been using this term for many years now, the ICROP3 has given it official recognition, which is that if you have, suppose you have zone 2 disease, and then there is one area that is bulging into zone 1, then you have to say zone 1 secondary to notch. So that is the importance of the term notch. So it leads to a more posterior staging, more dangerous staging of ROP. With that, we come to the end of my set of questions. I would like to hand it over back to the Dr. Madhu.
Thank you, ma'am. Yeah, can you stop sharing, ma'am? Yeah, is the screen visible, sir? Can I go ahead?
Yes, doctor.
Yeah. So the last set of MCQs for today's quiz. So what is the prevalence of corneal blindness in India according to the National Blindness and Visual Impairment Survey that was done in between 2015 and 2019? 2.5%, 0.90%, 5.5%, or 0.4%? And your time starts now. Time is up, and the correct answer is 0.90%. This is followed, the first most common is uncorrected refractive error, followed by cataract, glaucoma, and then corneal blindness. Let's go to the next question. Which bacterial organism causes rapid progression and corneal melting? The options are Staphylococcus, Pseudomonas, Streptococcus, Nocardia, and your time starts now. Time is up. And the right answer is Pseudomonas. So whenever you see a rapidly deteriorating condition in cornea, especially associated with melting, you should have a very high suspicion for Pseudomonas. Let's go to the next question. Indication for a triple procedure in Fuchs corneal dystrophy. That is, when would you combine it with the phacoemulsification and IOL implantation? 1, when the pachymetry is more than 640 microns. 2, when the endothelial cell density is less than 1000. Both 1 and 2, only 2. And your time starts now. Time is up. And the correct answer is both. So whenever the pachymetry is more and the endothelial cell count is less, it's wise to go ahead and do a triple procedure in the same sitting. What is false regarding Bowman's layer transplantation? It is a procedure that is done in advanced progressive keratoconus. It is a sutureless procedure. There are a lot of higher chances of graft-related complications. It prevents further ectasia. Your time starts now. Which of it is false? Sai? Yeah. Time is up, and the correct answer is high chances of graft-related complication. This is a safe procedure that is done in cases where they are not suitable for cross-linking and are too early a candidates for DALK or PKP. Now let's go to the final question. In penetrating keratoplasty, which sutures are called as the cardinal sutures? The first 8 sutures, the last 4 sutures, the first 4 sutures, or the last 8 sutures? And your time starts now. Time is up, and the correct answer is the first 4 sutures. After you place the first 4 sutures, you get a rhomboid shaped depression in the donor cornea, and this confirms the correct orientation of all the sutures. So that finishes the final round. Before I stop sharing, I would like to share the corporate video of our sponsors, Microvision.
Extra Lube Tear Substitute is a specialized formulation for managing hyperosmolarity involved in dry eye by providing extra care, lubrication, osmo protection.
Thank you. I'll stop sharing. I once again thank Prashant sir and the entire team for giving me this opportunity.
Thank you. Thank you, all the quiz master, Dr. Natasha, Dr. Madhu, Dr. Saurabh. It was a great quizzing. But trust me, as expected, 90% of the answers I didn't know. 50% Shilpi knew. So I think she always gives me complex when she's being a co-host with me, So before we start, we are waiting for the leaderboard. So we will be asking the top 10 performers of today's quiz episode. Rather, they will be joining us on the Zoom platform. We will be interacting with them. So hold on for a while, all the quiz masters. So we are waiting for our Sai and numeratic team to share that as well. People who performed well, the top 3 performers in the general ophthalmologists who are beyond PGs to join us. So Dr. Natasha, you can also join us for a chat. Till then, So we have, Sai, how much time you will need for sharing the leaderboard?
A minute, doctor.
A minute. Okay. So once we have a leaderboard, then we will get them into this PGs will be joining us on the Zoom platform. So Saurabh, how was the experience for you? Because Madhu has been with us in the Brain Teaser. He is a gang of Brain Teaser since a few seasons. So how was your experience to it, Saurabh?
It's a great experience, and I think it's a very nice thing that you've devised, and it's a good refresher, and it jogs your memory cells and takes you back to your PG days. So I think it's a very nice concept, and I think it's learning for everyone, not only the PGs. I mean, it's a good refresher for us as well. So I
That's
would
why
like-
basically why it came into my mind is that after 50s and being a private practitioner, I don't study like Professor Natasha and all. This teaching faculties, they have an opportunity, rather the students inside them poke them that they have to be better knowing the subject. And that is what keeps them, at the tetherhooks. For us, we think whatever we know is the best and the final. So this keeps me grounded again, and I know nothing, I remember nothing, and I have started even feeling that I am getting into Alzheimer's. What's the Professor Natasha?
Oh, it's the same with us. I got stage fright also. I couldn't remember palinopsia. I was like, my God, what's happening to me? So you've managed to give me Alzheimer's as well.
So
Yeah, but it was a great learning experience, especially seeing the other questions. Of course, it's always how much ever you learn, ophthalmology is like so vast and so changing that you cannot keep abreast unless you're always running to stay on the same place.
yeah, exactly. The most important thing I think Madhu, Saurabh, and Natasha will notice. These guys, when we are watching, they answer the one-liners within seconds. We give them 30 seconds. They type it, and after that, if they have any grievance, they also type a message to us. So look at the
How much time they have.
the speed with which they it really gives you a complex and really that this generation next is really wonderful, and we can look up to our country's future with this young ophthalmologist who will be probably taking care of our eyes in coming days. So we feel so proud and we become very confident with this young generation, I believe. So with this, I think, Sai, can we have the leaderboard?
Just sharing.
Yeah. So Sai will share the leaderboard. So PGs, just note, it is Jishnu again. Jishnu, please do join us on the Zoom platform. Team I, Team AIL, double I, Team OQ, Team I again, Team BOP, Team DU, and House of Drag. So request all these team people to immediately log on to the Zoom platform, get their audio video on. All the quiz masters want to see you people who have performed so well. And when we are doubting our own gray matter, we would definitely like to see who are these young brains who could answer and be on the leaderboard. Also, we have some of the practitioners who have been participating. It is the phone number is 9971565839. 8700368198 and 93150995559. These are the three people amongst the practitioner category who have topped today's episode, and they will be given the cash prize of 5,000 rupees, 3,000 rupees, and 2,000 rupees, which we give to the every episode winner. So Madhu and Saurabh, remember, not all practitioners are like me. They are competing and they're brushing their brains and they're rubbing their shoulders with these young PGs,
Yes, sir. True.
So let us see and interact with these people. I request all the practitioners as well as the winning team people to join us on the Zoom platform so we can have a small chat with you. Probably you might not be able to give the complex to Professor Natasha, but definitely to people like me as a practitioner to some extent might be. So, Saurabh, I don't know whether you will get into complex, but I definitely get.
Sai, people are asking how to join.
Zoom platform.
Madam, I have posted on the chat box. They're raising their hands and commenting. I'm promoting them to panelist.
Okay. So we have few of the PGs who have already joined us. So we have Nikita, no? So Nikita, you are there. Okay.
Yes, sir.
Can you unmute yourself?
Yes, sir.
So Nikita Gupta was one of the participants in last year's postgraduate quiz, correct?
No, sir. I was in the episode 2 of this season only.
Correct. So can you just introduce yourself, and the quiz masters can have a small chat with this girl. Where is your partner?
She's coming. She's rank 2.
Okay. Sai, can you just unshare your screen so that we can see these guys well? So Nikita, just in short, introduce yourself. Then probably Natasha is going to quiz you. Yeah, come on.
Good evening. I'm Dr. Nikita. I have done my post-graduation from AIMS and I've done my MCH in Vitreoretina from GI, Chandigarh. And currently I'm in the Center for Sight, Delhi.
So ma'am, she is into the private practitioner category. And so she is today ranked at number 1. So she is the topper. She has won the today's cash prize of 5,000 rupees. So Nikita, what keeps you going so well? Yeah, once I finished my post graduation, I just have an aversion towards the book. And the moment I take a book in the hand, I get a nice, it's like a lullaby, I feel.
Sir, I've been attending Brain Teasers quiz since 2 years. I think probably the time it started 2 years back, since my MCH in Chandigarh. So I have been hooked to Brain Teasers.
That's good.
What keeps you reading?
The thrill of the quiz and the cashman.
Okay.
I think once you get into that quizzing stream, then you can't resist.
Yes.
You have to keep reading.
Saurabh, she's a retina girl.
Yeah. So, and I think it's the double bill, the AIMS and PGI combination also, which, kind of
Correct.
they ingrain it in you, and yeah, I think that's what shows. So I think very good.
Thank you, sir.
Keep it up.
Keep it up.
Thank you.
So we will be sharing your cash prize. It will be delivered to you at the end of the episodes when we finish. That will be given. Okay, keep playing. We would love to see you more and pocket much more money for you. But definitely next time I will see to it that unless you share part of it to me, you're not going to make it.
Deal done, sir.
Done. Thank you.
Thank you, sir.
So now we have other person. We have a team.
Keratomes.
Yeah, team Keratomes. Can
Yes,
you?
sir. Good evening, sir. Good evening, ma'am.
Yeah. So can you introduce yourself?
Yes, sir. Myself, Dr. Aishwarya Kadam from Shankar Eye Hospital, Coimbatore.
Okay.
Dr. Gagandeep Singh, sir, from Shankar Eye Hospital, Coimbatore.
So Madhu, from close to your region as well as close to Natasha, I believe Coimbatore, equal distance from both of you. Influence on them?
Great performance. Congratulations.
Thank you so much, sir.
So, Madhu, you can quiz these guys, some non-academic as well. Let's see how.
So now you're into your residency, both of you?
Yes, sir.
Yes, sir. Third year, sir.
Third year
DNB students.
Third year DNB. What are your other interests other than quizzing?
Sir, I play golf.
Oh, great. Yourself?
Yes, sir. I don't have any interest right now.
Only interest is studying.
All the best for your final exams.
Yes, sir. Final exams are appearing.
Yeah. All the best. All the best for you.
Thank you, sir. Thank you so much.
So now the other team is Dipti and this team. Can you introduce? And Saurabh, you can quiz these guys.
Good evening, sir. This is Ajiba from Aravind, Chennai. And I'm Deepthi from Aravind, Chennai, primary DNB resident.
And who are your mentors?
Dr. Aarti is our mentor, sir.
Very good. And I've never been there, but I've seen your building. It's fabulous. It's one of the real, masterpieces which I've seen.
Thank you, sir.
So we know Dr. Anand Rajendran is from there. So I know Anand very well. He's a good friend. Yeah. So keep it up.
Sir.
Keep
the
it
quiz
up.
was very interesting. Thank you so much, sir, to all the quiz masters.
We have the best of the quiz masters.
Yes, sir. Every Wednesday, it's so motivating
such a
for
good
us
learning
to
experience every week. So we look forward to it.
Okay, thank you. So now I think we will move to team Panchami. I think we have Panchami. Ho gaya na?
Panchami.
Yeah, Panchami, come on, unmute yourself.
Sir, good evening.
Nikita's sister.
Correct?
Yeah, I thought so.
Yes,
Last year,
yes,
the
sir.
both were PG students. They played the first round of Big Q.
And they pocketed most of the money. I don't know, they are very greedy.
It runs in the
No, sir,
family.
so we have been playing this every Wednesday, and I think we come in the top 5 or something, but we haven't got any money till now.
At the end of the full
Season.
episode.
Yeah, all season we
All-
will be sharing all the money because people like you
Yes,
who are so greedy and grab every prize. We can't say, we have to see, calculate how much is the postage money which is associated with it. So we thought Panchami and this girl, we should do it at the last. Okay. So Madhu,
Sure,
what do you
sir.
think about these twin sisters?
No, we are not
Yes.
twins.
Not
I
great.
know.
Yeah. Actually, I think you should send them like a package at the end of all the episodes.
No, I'm just holding back because I want Shilpi wants some cut out of it. Shilpi is holding back that.
Yes. Surely, ma'am. Surely, sir. But it is very much fun. Like every Wednesday, we are hooked on to our laptops like that. We have to play this quiz. We have an early dinner and then we sit down for the quiz.
Where are you now?
Sir, I am in Delhi. I am practicing in MCD hospital. I've joined
Okay.
through UPSC. So
Okay,
I've joined as a medical officer.
Great.
Great.
Keep it up, Panchami, and keep up your zest for learning more and enjoying the knowledge as well. Very few people enjoy
Just a
learning.
small tidbit of information. Panchami and I walked the ramp together for last AIOC
Ah,
in
okay,
Mumbai.
okay.
Yeah, that's how we
Yes.
No, I think there was no sharing of questions between the two.
met. No. I just saw her
No,
popping
sir.
up on my screen just now.
Yeah, even I saw that, oh, Natasha ma'am is here. Then I was telling my husband, she walked the ramp with me last year. We both walked the ramp in AIOC in Mumbai.
Great. So it was great having you. Now we can have Team IQ. Team IQ, can you unmute yourself?
Yes, sir.
Saurabh and Madam Natasha, you can quiz this young
Where are
brain.
you from? Where are you from?
Sir, I am from Bangalore, Rajrajeshwari Medical College.
Very
Okay.
good. And where's your partner?
Just now he left, sir. Actually, he couldn't join us now.
Okay.
So great. So
Which year, resident?
Final year, ma'am.
Nice. So what are
Very
your other interests other than quizzing?
Nothing, just just ophthalmology, ma'am.
Okay.
Oh, it's so focused, huh? He's in a wrong company of people like me and Madhu.
And me.
Because we have ophthalmology as the last part of the interest.
Exactly.
Okay, so we have thank you at Team IQ. Now we have Dr. Subhiksha Padmanabhan. Can we have you unmuted, please? Subhiksha? Can you unmute yourself? Can you hear me, Dr. Subhiksha? Sai, any other teams have joined us?
No, doctor, I have onboarded all of them.
But we are seeing only a few of them only. IQ, are we missing any team? We
Only
are seeing
3
only,
teams.
we are seeing only 2 practitioners and this 1, 2, 3, 4,
3 practitioners.
3 teams. Only
4
3
teams. Yeah, 3 to 4 teams. Yeah. Other 7 teams are missing.
I've onboarded all of them.
Okay. But they are not visible on the screen. Or have they logged out?
They've logged out. Doctor.
Okay. So I think we had an interaction with most of these young guys and girls, in fact. So I think it must have been a great experience for you. It was your maiden appearance, Dr. Natasha.
Yes,
So
it was.
definitely we had a great time with you as well as Saurabh. It was a maiden appearance. Now, as I said, I share the screen with most of the people who are backbencher like me and Madhu, and I don't accept Shilpi. Shilpi is slightly ahead of me.
Front benchers.
So usually the screens were shared by people like me and Madhu in the previous episodes. So it was nice having you both with us in this particular
Thank you.
episode. So
Thank
thank
you,
you
Dr.
once
Krishnan.
more, and we would be looking forward to your more active participation in coming episodes as well. Because this particular thing which we started as a quiz as a very small thing 4 years back. In the first episode, it was a very small thing where me, Shilpi started it in a small way. Then we started getting in a second season, the gang, which included Madhu and all. And last year, we got into this idea why we should not have a one quiz for all on India for the postgraduate and get them on a single platform. And successfully, last year, we had 240 teams which participated. This year, the maximum participation was of 540 teams, and it was very encouraging. And definitely getting these kids,
600 teams.
600 teams to be precise, and they have played with us in the first and few of the episodes. And out of this 8 preliminary episodes, they are supposed to play compulsorily 4 episodes to be eligible for being into contention for the quarterfinals. So I hope each one of you enjoyed, and I'm also thankful to all the participants who hook on and log on to us on every Wednesday at 8 p.m. So guys, today we had the 6th round of 6th episode. 7th episode will be in the coming Wednesday, that is on 15th of February, again at 8 p.m. So do share this information with your other postgraduate friends and tell them that it is enjoyable. Yeah, we have one more girl who has just logged in.
Subiksha.
Subiksha, come on, before we just sign it off. Where were you? Get your unmuted. Yeah, unmute yourself and introduce yourself, please. We can't hear you. Can you unmute yourself?
Unmuted.
Okay. Yeah. So can you just put in and introduce yourself in a short, please?
Hello, sir. I am from Coimbatore Medical, Government Coimbatore Medical College, sir. First year postgraduate, sir.
Oh, that's so nice. Great of you that you could compete with this final year residents and all. So proud of you. Madhu, क्या बोलता है भाई? Saurabh, first year resident, rubbing shoulders with the final year. Most of them are final year residents.
Yeah.
And she's into top 10.
Second team from Coimbatore.
Wonderful.
Lots happening in Coimbatore. Very good.
Very good.
Thank you, sir.
Very well played. So friends, thank you once more for being with us. Keep playing better. It will be good. We are happy to have you again. So it's time for us to sign off. Thank you once more, Dr. Madhu, Dr. Natasha, Dr. Saurabh, and Sai and his Numeratech team for having this particular episode online uninterrupted. And also the Microvision team, which has been steadfastly behind us and has been promoting us and has been helping us, supporting us financially for conducting this episode every season. Of course, special mention of Mr. Ashok Kumar and Navneet sir for being with us and helping us grow day by day. And so it's time for us to say goodbye. Let's meet again on coming Wednesday, 8 p.m. for the next round of preliminary. Thank you, Natasha. Thank you, Saurabh and Madhu. Bye-bye. Good night.
Thank you.
Thank you. Good night. Bye-bye.
Thank you, sir. Thank you.
Yeah, congratulations to all the winners once again.
Of course.
Bye-bye.
Let's